the pro debate. Here are my disclosures. So the question is the inflammation related to HIV itself a factor in weight gain? When we look at the START study, what we see is that there are differential weight gains in those who start treatment immediately versus those who have deferred treatment, and that the weight gain is different depending on the viral load. And this suggests a role for inflammation, which is related to viral load, and suggests that there's actually a mechanism integral to HIV itself driving the weight gain. Why is that important? This is important because what we need to study is not people on PrEP, but people with HIV, because the mechanisms of weight gain may be different, and this may not be relevant to the discussion. I'll start with the integrase inhibitors and weight gain and first-line therapy. Lots of this debate began around the data presented at CROI in 2019. The NIH cohort data suggested greater increases in BMI over the first 2 years in those receiving integrase inhibitors versus PIs and NNRTIs, and they didn't establish any differences by race or sex. They further showed that people who were on second-generation integrase inhibitors, such as dolutegravir, gained weight at a faster rate than those on first-generation inhibitors. So this was the first evidence of causal association. When we look at first-line therapy studies, what we see is very varied and difficult to interpret findings. And this is related to the fact that they're very different populations. It's also related to the fact that these different studies looked at different categories. They observed both median and mean weight gain. So when you report a different variable, it becomes very difficult to compare like against like. And these cohorts are very different with respect to gender, race, age, weight, and other baseline demographics between clinical trial populations. So the eagle-eyed amongst you will have noticed that we were talking here about the third agent, but we didn't know what the effect of the backbone was. So can we remove the effect of the backbone and just look at the integrase inhibitors and what their effect was? Well, the answer is yes. Okay, because this analysis, which is a pooled analysis of 8 phase 3 clinical trials, looks at weight changes in first-line treatment for those starting treatment between 2003 and 2015, showing greater than 10,000 person years of follow-up. And this, because of the size of the analysis, was possible to stratify weight change by third agent, okay, and also by the NRTI backbone. So if we look on the left, what we see is integrase inhibitors in orange, showing statistically more weight gain than PIs and NNRTIs. When we look amongst the integrase inhibitors, we see that bictegravir and dolutegravir are showing similar weight gain, but more weight gain than elvitegravir. And we look on the right, we can see that there is an effect of the NRTI. And we're seeing that TAF is associated with the highest amount of weight gain, more so than abacavir, which is more so than TDF and more so than AZT. So we saw that participants taking integrase inhibitors experienced the most weight gain, but TAF was also a factor. Does the weight gain affect everyone in the same way? Well, in the advanced study, which is a study performed at a single site in Johannesburg, we've seen very, very dramatic weight gain in women versus men. And you can see this throughout the study. And this is particularly evident at week 144, when we look on the left at dolutegravir FTC TAF versus the right at efavirenz FTC TDF. And we can see that in some cases, this is associated with treatment emergent metabolic syndrome. In the advanced study, it's also important to say that the weight gain was predominantly fat mass rather than lean mass, and women gained significantly more fat mass than men did. But also there were significant outliers who gained more than 10% change in their body weight and had significant treatment emergent obesity on the dolutegravir FTC and TAF arm. But this isn't only limited to South Africa. When we look at the NAMCEL study, which occurred at 3 sites in the Cameroon, comparing D2G TDF3TC versus TDF3TC efavirenz 400, what you do see is a BMI difference in terms of the mean change from baseline, statistically significant differences for weight, for BMI, and also for treatment emergent obesity. So this is a different cohort. But going back to that original multivariate analysis of this very large study, what we see here, even in well-resourced countries, when we look at women and Black people outside of the African context, we're still seeing a weight change effect stratified by sex and by race. So this is a very important thing to notice. So in terms of take-homes, the take-homes are that weight gain with initiation occurs more in women, Black people, and Latinx people, and there's more with integrase inhibitors. Why this weight gain? Well, starting antiretrovirals and controlling HIV reduces inflammation and catabolic effects, especially in high viremia. So without this effect, if you eat the same, you'll gain weight. But is the weight gain the same for integrase inhibitors versus other third-line agents? My answer is no. What about switch? So in switch study, in the OPERA cohort, weight changes with switch from TDF to TAF while maintaining other antiretrovirals by class of anchor agent. You can see that between 0 and 9 months, people gain weight when you switch, but numerically, the changes were higher in the integrase category than the other classes. And once again, in the second generation integrase inhibitors, DTG, BIC, more so than alvategravir. So in terms of a summary for weight gain in switch, weight gain occurred in antiretroviral experienced people, suggesting a different or additional mechanism that's not just reversible of catabolism or inflammation. There's some modulation of adipose tissue potentially, and the outliers remain a concern. So what is the mechanism? Well, increased fibrosis in adipose tissue, both VAT and SAT, has been shown in people with HIV on integrase inhibitors. And this is different from people not on integrase inhibitors. So I think that although the mechanism is complex, it's important to recognize that there is a mechanism emerging of how integrase inhibitors may be structurally different. There's accumulating evidence that integrase inhibitor-based treatment is associated with greater weight gain than other drugs, affecting Black and Latinx people more and women. Whether there are differences between integrase inhibitors is less clear. The role of TAF as additive, multiplicative, or neither is unclear, but the mechanism is clearly important and leaning towards a role for integrase inhibitors. Thank you for your attention.